This is not a disease, this is a human story. This is a new reset to how we can be humans, I think, to one another. We've been so involved in our activities, our business, our events, and now being on lockdown, we're suddenly just one-to-one again with our families, with our neighbors. We've slowed down to where the human interaction, that's the thing that really counts. The big thing that turned around the medical protocols, I think, was that when we looked at our patients, they did not fit what we were supposed to do. And so we had to go back to a really, really ancient axiom of listen to your patient. They don't sound like the typical ARDS patient. They don't sound like just a pneumonia. They don't sound like that. Something else is going on. It is hard because this has been an unimaginable type of disease process. And to be in isolation is a whole different ballgame. Some of our ICU people are there for 4 weeks. This is unheard of. And for the families to be suffering at home and for the patients to be suffering in the hospital, it just compounds everything together. A lot of times the healthcare workers, you think of just doctors and nurses and things like that that are being the heroes. Some of the real heroes in the emergency department, they're my housekeepers. They're the ones who turn over the rooms in rapid fashion. They have to go in there and clean the COVID. They have to go and do the ultraviolet lights, and yet they do it. They do it well. They do it with excellence. I think sometimes they feel like they're not part of a medical treatment plan, but they are absolutely necessary, because if I don't have the right room, I cannot treat my patients, and they make it happen. So I'm just really proud of the whole team from A to Z. I'm a believer in Jesus, and I know God loves me. God loves my family. God has given me the ability to right now be on the provider end, and it is an honor to be able to love as He would love. It's just that simple.